I'm just going to do a quick update on the numbers just to get all of us on the same page here. So we have about 10.5 million people in this country who have been infected with COVID, and about 250,000 deaths so far. The number of infections continue to rise. The daily rates of new infections are at 120 to 150,000 cases, about a 60% increase from the last 2-week trends. About 1,000 Americans die from COVID every day now. We're clearly in the third wave of the pandemic. The numbers are actually much higher than the first two waves. It's happening at a very bad time. Flu season has not even started yet, and we're already getting reports that hospitals are being overwhelmed. In addition to concern about bed shortages, healthcare workers are dying and burning out. They've been doing this for close to 7 or 8 months now, and we may get into a situation where we may have beds, we may not have enough people to staff it. So these has implications that's beyond those unfortunate enough to get COVID. Anyone with any medical condition that needs hospital care in the next few months are going to be impacted. So I want to start by asking Dr. Jha and Dr. Shah a question about the current state of the pandemic and what's going to happen in the near future. What do you think will happen in the next 2 months? And what can we do to change the course? And we can start with Dr. Shah and then go to Dr. Jha.
Unfortunately, as you can see, the numbers in the United States are at an all-time high and trending in a wrong direction. And we know exactly why that's happening as well. This is not a surprise. We predicted this, that with the fall, with people staying indoors, and without the kind of broad protections we know we need to take, such as masking, such as not gathering in large groups, the numbers will continue to rise. So this is not necessarily a surprise, unfortunately. And at the same time, we also know what we need to do to get the numbers under control. So we do need to not wait until the new administration, but start making changes now. You may have seen that today, New York City has canceled public schools again. And so we are going backwards. We're not going forwards at this time as a nation.
Thank you, Dr. Shah. Dr. Jha? Please unmute Dr. Jha, please. You're good.
Okay, great. Thank you. Liz, let me just build on what Nirav said. We are in the worst moment in the pandemic right now. We have more infections in the United States than at any point. And that's not just based on the case numbers. We have a lot more testing, so we do have a lot more cases, but it's just we have a lot more infections now than we've had at any point. Right now, we have about 100, as you said, about 120 to 150,000 cases being identified every day. But the truth is that the true number of infections that are occurring in the United States right now is between 300,000 and 400,000 a day, maybe even closer to 500,000. We're just missing 2/3 to 3/4 of all of the infections. We're missing them because our testing is inadequate. And so because of that, all the people who are not being identified are, of course, out there spreading the virus to others. And we're in the moment of exponential growth. And so by all expectations, we have 1,000 deaths a day right now. We will get to 2,000 deaths a day by mid-December. And my estimations are that we're going to have an additional 100,000 Americans die of this disease between now and the day that Joe Biden is inaugurated president. That's what we're on track for. And don't think during the entire 9 months of the pandemic, I've been on the front lines. I've been very deeply engaged. I don't think I've ever felt a moment where there's a bigger disconnect between how bad things are and how little attention we as a country are paying. That contrast right now is baffling to me. I don't understand it. I don't understand why. And here's the one last part, which is, and I know you may want to get into talking about vaccines. We are so close to getting to a point where the pandemic starts getting under control. And so to me, it's particularly unconscionable to lose another 100,000 Americans over the next month and a half, 2 months, or let's say next 2 months, when we know that we are going to end up in the spring with, I think, highly effective vaccines that will make a very big difference. And so it just feels like we're giving up right at the last minute when so much suffering is on the line, and we can largely prevent it by many of the things that Nirav talked about.
I just want to follow up quickly on that. We are in this state, and why are we in this state? I mean, I think beyond what we each individual can do,
Yeah.
Why are we here?
We're here for three reasons. One is we've had a federal government that 2 months ago made a strategic decision to stop engaging and helping with the pandemic. When Dr. Scott Atlas really took over the coronavirus task force, his strategy has been, he's been very explicit about it, that he believes America is better off if we just let the infection run. And I think it's unconscionable, and I think it is not based on science, but he believes that. So what that has meant is that the White House's footing, which has always had been, we should control the pandemic. We can criticize whether the White House was doing a good enough job or not, but at least publicly they were saying they were trying to control the pandemic. Now their footing has changed to we're no longer trying to control the pandemic. And we heard that from Mr. Meadows, the chief of staff. So that's been one, but the White House has let go. Second is that there has been no aid from Congress to states and to individuals. And so states are in really bad financial shape, and individuals are, and states are making, I believe, a series of bad choices. So New York City public schools are about to close, but indoor dining is still open in New York. In Boston, the Boston public schools are closed, but casinos are open in the greater Boston area. First of all, I think from a societal point of view, closed schools but open casinos are the wrong trade-offs. But from a financial health of the state point of view, casinos bring in revenue, schools do not. So what we need, we've also had an abdication by Congress that has chosen not to provide any support to states over the last 4 months. And that has been, and then the third is, I think, just individual fatigue. People are tired of this. They've been going on this for a long time, and they're not seeing much action out of their political leaders, and they're letting their guard down. And you put all of that together and you are where we are right now.
Dr. Shah, any additional thought on why we're here?
Yeah, I think Ashish did a really nice job summarizing the multi-levels of failures of leadership that we've seen. I'll give you specific examples. We know some CARES Act funding has gone out to the states, and several states have not even spent it. They've been claims of hoarding that money for who knows what, as opposed to using it for public health. So there's lack of leadership on many levels has led to where we are. And what we need is that strong, unified voice, one plan that we all agree to that leads to control, like other countries have done.
So I'll follow up on the question about leadership. So, Dr. Jha mentioned that the Biden administration will take over in hopefully the third week of January. It is a long wait until then, but what should Joe Biden and his team do on day one?
So do you want me to start us off on that?
Yes, please. Yeah.
So there's a lot that the Biden administration can do, the Biden transition team can do between now and January 20th. So obviously they don't have any formal powers. I often say, that Mr. Biden has no more power right now than he did a month ago or a year ago. He's a private citizen. But he's not. He's president-elect, and his team is got a lot of soft power, and soft power is what we need right now. So I think Mr. Biden should certainly be very actively engaged himself in talking to people about wearing masks. I have recommended that he consider doing a road trip to red states where there's a lot of skepticism about mask wearing, and talk to people openly and honestly about why wearing masks is a good thing to do for yourself, for your family, for your community. Will it convince everybody? Of course not, but we don't have to. Any movement on that, I think, would help. From the transition team and the COVID task force, one of the major problems we have is we have wholly inadequate testing. One of the reasons we have wholly inadequate testing is that there hasn't been a clear market signal to providers of testing. So I have probably spoken to every major manufacturer of testing in America over the last couple of months. They can ramp up testing a lot more, but they don't know that anyone is going to be on the other side to actually buy the tests, and they can't afford to make the investments. The Biden team can start saying to people, we're going to be in office in 2 months. We promise you we'll buy the tests. And that is a credibility that will have a huge market signal to these companies. And I can imagine a large ramping up of testing that they can do. And then the last thing is, I believe they need to be talking to members of Congress, to both Democrats and Republicans, to get a stimulus bill out that gives money to states for testing and for other things, so states can start playing a more active role. If those are three things they can do right now before they show up to power on January 20th.
Yeah, I agree with all those. I'd add one more. I think the lack of trust in science is at an all-time low, And our solutions will be successful if people trust in science, if people trust in a vaccine when it's available, if people actually take both doses of the vaccine when it's available, if they're offered. Those are things that we need to work on now to rebuild the trust. When we talk about masks, it's not a political issue, it's a science issue. And starting to understand how science drives decision making, and understanding and connecting the dots for the general public as well as our leaders, saying this is what the evidence shows, this is where we have equipoise or we're not sure. And based on what we know, we believe the following: avoid large gatherings, practice physical distancing, wear masks, stay home when ill, and self quarantine after exposure. Those are simple things, and it's our job collectively as the media and as leaders to repeat those messages every chance we get. The CDC report today showed two reports of spreader super spreader events, one in rural Maine at a wedding reception and another in the Amish community. And it's because those simple things that we know to reduce transmission weren't performed. When you have 55 people at a wedding reception, when the state limit is 50, you're doing something wrong. When you're not wearing a mask and you feel ill and you're going to work in a long-term care home, it's no surprise there was a secondary outbreak in a long-term care facility. These are things that we knew back in March, April, what we should be doing, and yet we're not doing it because we do not have that trust.
Thank you. I want to turn over to the vaccine. I know you all, I have to turn over to Sunita in a couple of minutes, but thoughts on the vaccine, starting with Dr. Shah and then Dr. Shah.
Sure. So certainly the news from Pfizer is early good news that we're in direction, and that there is evidence of with 2 doses of positive news. But the reality is that's just 10 to 20 million doses maximum by the end of the year, and there will be a ramp up after that. But it is going to be some time before we get the kind of widespread availability of multiple vaccines with a secure supply chain that gets everyone the 2 doses they need to actually start to achieve even partial herd immunity, forget full herd immunity. And so if you're thinking about when does life get back to normal, it will require a multiple pronged strategy. In the short term, meaning in the next 6 months to a year, we cannot hang our hat solely on vaccines. It will be everything else in addition to vaccines, protecting essential workers, the vulnerable elderly in nursing homes and others. But the vaccines will ultimately get us out of this, I think, in 2022.
Dr. Shah.
Yeah, not a lot to add, so let me maybe make a couple of quick points. First, the Pfizer data, we haven't seen much data. It's a press release, but we've looked at previous phase 1, phase 2 data from Pfizer, and I have to say this was a surprise. I was expecting, even last week, I was speaking at a conference and saying that we will be lucky if the vaccine is 60 to 70% effective. A 90% efficacy was not what I was expecting. And boy, am I happy to be wrong in that direction on that. So, but it also had a couple of other effects. So while that is true for the Pfizer vaccine, and again, we'll have to see the data and see what it looks like. The second part is that it makes me more optimistic about other vaccines, including Moderna, which is a very similar vaccine construct, but even the other ones that target the spike protein. So I've become more bullish about vaccines in terms of their scientific, in terms of their impact from a science point of view. There are some enormous challenges for the Biden administration in terms of this vaccine. So as Nirav said, first of all, we're gonna have to ramp up production. Production is important. A lot of these vaccines have to be stored frozen and transported frozen. There's a huge logistical supply chain set of challenges there in just getting the vaccines out into the community. You know, the old line of vaccines don't save lives, vaccinations do. There's a huge challenge from a supply chain perspective of getting the vaccines out. And then last, but certainly not least, and maybe even the most important at this point, is that there's a huge challenge around vaccine hesitancy and around engaging people, especially in communities of color, but other places as well, to help people understand why they should get vaccinated. We're not going to have mandatory vaccines by and large, and we're going to have to really engage with people, understand where their distrust comes from, engage with that, engage community and civil leaders and religious leaders. This is going to be a all hands on deck to work with people to get a high level of vaccination. If we don't do that hard work, by the way, and we just put it out there, 30–40% of Americans will get vaccinated, and that will not be enough to bring the pandemic under control. So a lot of hard work ahead for the Biden team, for states, for public health leaders, for all of us, for journalists, in really clearly communicating to the American people what the benefits and challenges of the vaccine are.
Thank you. I want to turn it over to Sunita for press questions.
Yeah, I wanted to start off with a question myself. How confident are you, Doctors Jha and Shah, that we can get the vaccine out to the communities that most need it? People of color who have been underrepresented in healthcare during this pandemic.
So I'll start by just saying I am confident it can be done if we are deliberate and focused on doing it well. And it meaning, another way to say it is, it won't happen naturally. It won't happen automatically. Communities of color have been really hit hard in this pandemic. There has been, one of the things that I think has been a bright spot has been that the companies doing the trials have been really focused on making sure that they have a diverse set of volunteers. So we're not just testing it in 18 to 30-year-old white men and women, but in fact, we're testing it in a broad swath of America. I think that is happening, and not perfect, but happening. Part of the reason the Moderna trial got delayed was actually to do a better job on diversifying their recruits. If we finish with that, and then we really go out and engage with communities, try to make sure that we prioritize high-risk people who often are people of color, I think we can do this. But what I worry about is a lack of a deliberate effort and just hoping that it'll just naturally happen. And we all know what happens when we don't make a deliberate and proactive effort. It doesn't end up working out well.
Dr. Shah, anything to add?
Just that we have been extremely creative in our vaccine development, for example. That creativity is across the spectrum. There have been creative approaches to exposure notification, to contact tracing, to engaging with communities, to resulting tests of COVID by text messages, for example, from a company named Healthvana. So we can reach people. We know how to do it. We've been thoughtful about it. We just need to do it in a more structured and standardized way, as opposed to the 1,000 points of light approach, where every state, every city is doing something on their own. Simple coordination using evidence-based approaches will make a big difference here.
Yeah, so the data on the this trope that the president has been saying, that we have more cases because we test more, is just untrue. Testing is actually a really important strategy of keeping the virus under control. And in fact, the state that does the most number of tests per capita is New York, and on a per capita basis, they actually have far fewer cases than everybody else. There's no doubt in my mind that testing and tracing could make a really big difference. Just testing alone can make a very big difference if there is widespread availability of testing, and people, after they test positive, self-quarantine. It can make a big difference. But unfortunately, that's the challenge with that right now.
Yeah, we need several things to happen. Testing, sufficient testing across the country is one part of the solution, but it isn't the whole solution. We also need sufficient tracing capacity and ability after we get enough cases down under control. You can't trace every case when there's thousands of cases to trace on any given day. But once you get it down to a manageable number, you can actually trace them and self-quarantine and do all the things we need to do. So what we need is the approach where we do a little here, a little there, a little elsewhere, will all collectively bring the transmission rates down enough. That's the goal. We do not have a silver bullet. Testing alone won't work. Tracing alone won't work. Physical distancing alone won't work. Wearing masks alone won't work. All of these together will collectively bring us to where we need to be and start bringing transmission below 1 so that we actually see cases go down.
My question is about travel restrictions. With all of the upcoming holidays, particularly air travel in and out of states, do you think more stringent travel restrictions should be, or guidelines outlined for travelers, aside from the voluntary 14-day quarantine? expecting people to just do the right thing seems to be hit or miss.
So let me quickly just start off by saying I think in general, travel restrictions are a bit of a sideshow. I don't think they make much of a difference. Um, Obviously, there is some risk in travel itself, but it's not particularly large. And we don't think that a lot of the virus is, well, I mean, so yeah, so not a lot of it is spreading from people going from high risk to low risk areas. We do see obviously across state borders. So you do see like the large outbreaks in the Dakotas, then spills into Wyoming and Montana. But that's not, most of the travel restrictions aren't going to be able to prevent that. So my general take on travel restrictions is lots of states have them across borders. They probably make marginal differences at this point, especially given how widespread the infection is. And that's not where most of the infection is spreading. And so what I've been saying to governors and health secretaries is, if you feel like you need to put them in for political purposes or you want marginal benefit, it's fine, but don't be distracted that that's somehow a strategy. It's really not. It's a marginal gain at best. And obviously on the international side, it's a much more complicated set of issues depending on which country. If you're an island like New Zealand, you do probably want to put in travel restrictions to make sure you don't get a whole lot of infections from other places. But generally, I don't think it makes a very big difference.
A little concerned or a lot concerned because I see that there are people that constantly anxious about getting COVID-19 and they go to testing almost every week. All the time they are negative. And I think I had the idea that they are, or I wonder if they are not stealing the appointments to other people that really need it. So I don't know if you can address in what cases do we really need to go to have a test, and also how to create trust in a COVID vaccine among the Latino community when we have one, because there are some people that maybe don't trust because it's a new, wouldn't trust because it's a new vaccine.
Yeah, actually, those are two really good questions. The first one around how to make sure the test actually, it's sort of not, it's a half of a question, because one half is people maybe getting too many, and then the other half is maybe people don't get enough. My feeling about it is right now we need to encourage people who are doing the right thing. And I would not be in the business of discouraging people from getting testing. Certainly, we do need do a better job of telling them to get tested if they think there are potential exposures. A lot of people are testing too because, particularly with the holiday season coming up, they want to go see their relatives. And even though testing is really not completely, rules out the fact that you can't pass on the infection to someone, they're doing that. And so in a way, it's sort of allowing people to cope with sort of the sense of lack of control. On the vaccine acceptance side, I think that's a big question. I think that again, I wouldn't approach any population as a whole. In other words, even though there are distrust with vaccines and with science in certain segments of each racial and ethnic population, I think what we need to do is tailor our messages appropriately. There will be a lot of African Americans and Asians and Latinx people who are ready to get the vaccine. We need to get them the vaccine. There are those who are not ready or don't want to. I think we need to address the concerns that they have directly, particularly to you all. Once we have a better idea of what the effectiveness and the side effects are, we need to get that information out. The more trusted information we get out to the community, the better in terms of convincing them to get the vaccination.
Do you think the Biden administration should have a national mask mandate?
Yes, I think we do. I think, look, back in March, we were talking about, flattening the curve and all kinds of stuff. And all of that does not work without an integrated, coordinated response. And that has to come from local, state, and federal. And you can see, looking at the various different states and how they've done, how state-only management can really help. Like some states have done a better job than others. But without the coordination from the federal government and a strict messaging of some very simple messaging, we've been talking about sort of like how complicated It doesn't have to be complicated. Wear a mask. I mean, even if all we had in the last 7 months was everyone agree as far as leadership is concerned to wear a mask, we may have 100,000 less deaths. I mean, the data on the mask wearing is not like perfect, but everything that we look at as far as mask wearing suggests that it's effective in preventing infection. And modeling has shown that we can save 100,000 lives if we had actually 80 or 90% of us were wearing masks. So yes, I am all for that. I just want to ask a question about the vaccine. I've had what you're thinking about the vaccine in terms of both its efficacy and its implementation in the next few months or so.
Well, I think we're likely to have two vaccines fairly quickly, the Pfizer vaccine and the Moderna vaccine. And the Pfizer vaccine, of course, through a news release, we haven't seen all the data, says that it's over 90% effective, which is stunning. That's more than most of us believed. Now, let's assume for the moment that all the safety issues are fine and we get an emergency use authorization. At least in this country, then, we will distribute this vaccine in a prioritized fashion. First, to healthcare providers who care for patients with COVID in hospitals, in nursing homes, and emergency first responders. And then subsequently to high-risk people, essential workers, and the rest of the population. This will all take a great deal of time. Now, the distribution is complicated by the fact that these vaccines are very fragile. They have to be kept very cold. And in particular, the Pfizer vaccine has to be kept at minus 80 degrees centigrade through its shipping and in its handling. They have worked out methods to do this, but still, this means this vaccine can only be given at distinctive locations where the personnel are very well trained to do this. This is not a vaccine that will be available at the local pharmacy or in a physician's office. But in the beginning, at least, that's okay, because most of the people who will be receiving it initially will be healthcare workers, many of them in hospitals. So nonetheless, organizing that is difficult. For example, in my own state, how do we get this vaccine out to rural areas, in smaller hospitals and in smaller nursing homes? We're going to do it with trucks, and we're going to have teams circuit ride to go out and do that. And then there's an additional complication, because these are what we call reactogenic vaccines. They hurt, and they may make your arm very sore for several days, can give you a fever, can give you aches and pains. You're not feeling entirely well. You might even get a degree of fever or a headache. That's your immune system working to start with the vaccine to develop your protection. You're not getting COVID. You can't get COVID from the vaccine. Please don't even think about that. But that does mean if you go to a small nursing home somewhere, you may not want to vaccinate all your people on the same day, because the next day and the day after, some of those people may not be able to come into work. So we're going to have to do this in phases, which will make all the logistics even more complicated. So more to come about all of that, sir.
Thank you. I thought that was a really important point you made about side effects. I think we need to be, again, from the media's perspective, be clear that there will be side effects and to expect it, because the trust is going to happen, the distrust that's going to just get worse if people are getting the shots and they start telling their friends that it hurts and they're having the flu, they're getting a mini COVID or something. This is how people talk to each other. So from our perspective, the more that we are upfront about what the side effects are and what to expect, the better our chance of getting a greater uptake. What about treatment, Dr. Shana? Is there anything new on the horizon?
Well, treatment has progressed. I mean, we've learned an enormous amount about how this virus, this very nasty virus, can make you very sick. So just in the regular supportive care of patients, we've learned terrifically more about what to expect. So we're doing a better job of getting people out of the intensive care unit and out of the hospital we are lowering the fatality rate. And then, of course, we have two medications that provide at least some benefit. The antiviral remdesivir, which is most effective earlier in the illness, and the steroid dexamethasone, which has been around for over 40 years, but that helps with the dampening and controlling the inflammatory response in the second half of the infection. But what's new and just now has been given an emergency use authorization is, of course, the antibodies, these monoclonal antibodies, and exactly who should get those and at what stage of the infection has not yet been determined. And that's also a little bit complicated because they have to be given intravenously. So we're going to have to define the target patient population for these drugs, how to organize their delivery, and of course, the practical aspect, who pays for all that?
I wonder how we're going to get the vaccines out to the most vulnerable communities of color, especially who may not have access to healthcare.
And on top of that, Sunita, is that we have the difficulty that already on several surveys and talking with colleagues who are African American, who work in African American communities, that the skepticism, the reluctance on the part of particularly the African American community, but also other ethnically defined communities, the skepticism is very high and very strong. So we're going to have to do everything we can to reach out to them, provide information, but more important, it's the attitude. We're going to have to provide reassurance, and people who look like them, not me, are going to have to do that very important role. Perhaps we can work through, as is often the case, churches or people who are prominent African American leaders to reach out to this community. And Mark Twain told us the way you bring a reluctant man down from the second story, one step at a time. Mm-hmm. So we're going to have to do this in a sustained, diplomatic, gentle way. And what I hope is that the politicians now will step back, now that the election is over, and they put the public health people in front, and the doctors, and the scientific community, because I think that will help restore trust, frankly. There's still a political veneer over this vaccine, and I would like to remove that, because the more we can base it on science and public health, I think the more successful we will be.
I particularly wanted to ask Dr. Nguyen what he thought of California's battle against COVID-19 and whether he had any recommendations for California specifically. And then I'm really interested in both Dr. Nguyen and Dr. Schaffner's opinion on why closing schools has become an imperative, where closing restaurants and casinos is seen as an economic risk, but schools are reportedly the safest places. Why are we so bent on closing schools, and do they both agree that that is the correct strategy? Not to say either or, maybe we should close everything, but why in particular schools? It seems very politicized.
I'll start with an answer about California. I think, even the cases are going up California. So even though I think California has done a good job, it's just tough. These decisions that even with good leaders, the choices they have to make are really, really difficult. I think the way they set up the various tiers for each county, requiring them to meet it, and then monitoring it before moving them to one tier or another in terms of reopening or expanding more social interactions, I think it was absolutely the right way to go. And the fact of the matter is, in Northern California, even in San Francisco, where I think we're doing really, really great in terms of the cases over the last few months, it's still going up, and now we're thinking about taking a step back. So I think it's do something, monitor it, adjust accordingly. So that might be the other message, is that people think that every time you don't stick with the same strategy all the time, that you don't know what you're doing, but it's actually the other way around. You have to adjust your action based on what the data is showing. And so, again, I don't think it's perfect in California. I think the other strategy in California that I've been aware of is that they are thinking a lot about racial ethnic disparities. I know that there are some special initiative, for example, with Latinx patients in the Central Valley, things like that. They've actually prioritized these minority populations that have a high burden, and beginning to do very specific things about that. I want to turn the school question to Dr. Schaffner, because I'm not sure I have a good answer to that question.
Dr. Nguyen, very clever of you. First, I would like to agree with you, but I'm going to take it a little step further. I think perhaps going forward, we will have a more nationally coordinated approach. At the moment, the approach has been subcontracted to the governors, and we have kind of a crazy quilt of approaches out there, some of which clearly are not working at all. California is really among the best. I'm impressed. But if I could wake up in the morning and have every person in the country walk out their front door wearing a mask, that would make my heart sing. Schools are a real problem. First of all, they're close to the heart of all the parents, right? Fortunately, the children, as we all know, are they're not immune, but they're less affected than adults. I think there's general agreement that the degree of control in the community has a huge impact on the relative safety of opening up schools. Also, schools with more resources, the facilities to actually implement a variety of containment measures, social distancing, and a whole series of things we could talk about, are obviously in a better shape than schools who limit those resources. We all want children to go back to school for, and again, a whole list of reasons. I think school closings should be the result of data, just as Dr. Nguyen says. If you have a big outbreak in a school for one reason or another, you'll probably want to go back to virtual learning for a period of time and revisit what you didn't do well enough to start. And so at the moment, we have school policies that are even more varied than the policies in all the 50 states across the country. Private schools, public schools, inner city schools, rural schools. There are a lot of different approaches, some of them in my own state colored by the local politics, as a matter of fact. And I don't think that there is one good answer. In general, I would say, see if Dr. Nguyen agrees with me, the school openings that have occurred, no matter how heterogeneous they are, have been on the whole, I think, a little safer. It's gone a little better than we had feared.